My name is James P. Ashton, and I'm 76, just turned 76. Presently, I serve as a pastor of Southside Church, and I've been there 31 years. A little over 2 years ago, I found that using my hip caused me some pain. It affected my mobility. So consequently, I was sort of hopping in movement, which created pain. It became a little unbearable. And I said, well, I have to do something about this. So inevitably, I went to Dr. Wynn's office.
I'm Michael Wynn. I'm an orthopedic surgeon here at our Johnston-Willis office with Ortho Virginia. The orthopedic service line at Johnston-Willis is a diverse line. We cover most orthopedic specialties, anywhere from joint replacement to hand surgery to spine surgery. The most common procedure I do is hip and knee replacement. Hip and knee replacement really offers the patients the opportunity to get back to a more active lifestyle, to regain some of the things that they wanted to do previously in life that arthritis has kept them from doing. Mr. Ashton presented to me with a prolonged history of pain in and around his right hip. His x-rays showed pretty severe arthritis of his hip, so long-term prognosis for his hip without surgery was not good. In order to return to the type of life he wanted to live and to remain active, hip replacement would be the best option.
I felt convinced I needed to do this and needed to do it as quickly as possible.
The total hip essentially removes the femoral head ball, which has become arthritic and degenerative. We then put a prosthetic cup in, usually with a plastic liner, and then we put a stem in the femur that has a prosthetic ball that comes off of it and can be reduced into the cup and reforms the hip socket. His surgery went very well, and he was discharged from the hospital relatively quickly afterwards.
It's one of the best things that's ever happened to me. The same day of my surgery, I was up and moving. In my mind, I'd anticipated several weeks, even to be able to get out of the bed. I got rid of the cane and the walker after about a month. I'm able to bend and have more flexibility. Even sitting and stooping, I think I couldn't do that before. And I feel like a new man.
I think Mr. Ashton's prognosis is excellent. I think he has a very good chance of continuing to have a hip that functions well for him and remain active.
I've returned to full stride in our church, and thanks be to God, I had two beautiful daughters to help me along that process. And since my wife had passed just a year prior to that, I felt this would be a picker-upper and something to give me some mobility to do what I needed to do and maybe forget about what had happened in my life. I'm a proponent for good health, mentally, physically, and spiritually, and you have to make a step in the right direction. When you seek it, then you'll find it. It's changed my life. So I'm thankful, very, very thankful.